Good morning. Thank you for allowing me to come up and introduce and talk a little bit about the progress of your local hospital, your community hospital, and where we're going over the next 4 or 5 years. And so as we run through this, just give you a brief update. We're going to talk a little bit about our recent improvements, our strategic plan, and a little bit about our master facility plan, which is really just the physical plant and buildings that we work in. And so, there we go. Everyone in the room knows where we were 5 years ago as a health system. This was the outlook. We had 1 star from CMS. And if you don't know the rating system, just like you would think, more stars, the better. So 1 star was not good. We were losing $26 million. Our patient satisfaction experience was in the 9th percentile. Again, as you might imagine, the higher the number, the better. The lower the number, not so good. And so we had lots of opportunity. The board asked us to make some changes. You asked us to make some changes. And let's talk about where we are today. And so let's quickly move forward. Hopefully, if you've had the opportunity to experience care at Nash, you've noticed a difference over the last 5 years. We now have a positive operating margin. We've climbed out of that $26 million hole that we were in and are actually one of the leading hospitals from an operating margin standpoint in the UNC health system. Our patient satisfaction, which by the way, now the industry calls it patient experience. They change that up every 4 or 5 years so that I always have to have a card to remember what we call it. So patient experience, we're now above the 50th percentile. We're receiving top accolades from agencies like the Centers for Medicare and Medicaid, so CMS. We're now a 4-star hospital. Leapfrog Group and other publications are recognizing the work that our staff, medical staff, and board are governing us and moving. We've also rebuilt the trust with the community. How do I know that? Our net revenue, and so I'm speaking to the business community this morning. You can appreciate this. Our net revenue over the last 5 years has increased by $70 million. And that's by, thank you. That is by more business and capturing market share. So I'm very proud of the staff for their work. And I want to thank the board for their vision and that continuously hold us accountable. My chair is here with us today, Bill Lane, as many of you know. Bill, he's one of the most popular men in Rocky Mount. All because of his personality. It could have something to do with his restaurant. But our medical staff and our clinical staff and support staff that work tirelessly every day to help us meet our objectives. You and our community who allowed us to get a second chance if perhaps your previous experience was with us did not meet your expectations. So thank you for giving us another opportunity. And then for everyone that participated in our strategic plan and giving us feedback about what we need to do. We do a strategic plan every 4 years. This is our most current strategic plan. It was finished in winter of 2023, adopted by the board in April, and implemented at the beginning of our fiscal year, which is July. And so I want to thank those who participated and gave us your feedback. And this certainly isn't meant for you to study. This is kind of our one page scorecard that kind of is our guiding North Star. The areas that you need to focus on is that the 4 areas that we're focused on in the next 5 years is ease of access, expanded service offerings, exceptional quality, and patient experience and workforce and community engagement. So those are the areas that we will be focusing on. You may be surprised to learn that 50% of our business comes from outside of Nash County. So we really are a regional hospital in that sense. We receive patients, part of our strategic plan and is part of specialty services, and which is just simply broadening and deepening the level and type of care that we offer locally. And so one of the ways that we're doing that is we're expanding our footprint to be a regional hospital, a transfer-in facility to help hospitals in Eastern North Carolina who don't have the services or can't care for the patients at their facility to be able to refer those in to our facility. That is a dramatic cultural change for us as a business. Why is that important? People ask as we start this endeavor, why would we do that? Why don't we take care of our communities, our local communities first before we start worrying about the region? And quite simply, in order to broaden and deepen the level and type of care we provide, we now must recruit and be attractive to subspecialist physicians that our local population simply cannot support. They simply don't have the volume here in Rocky Mount, Nash County, Halifax, and Edgecombe to attract the volume for those subspecialists. So by broadening our footprint, we allow those subspecialists to have the volume that allows us to have those services here locally for you, while also helping the region that we are broadening to serve. Danielle Wagaman is here with me today. She is almost single-handedly, along with Dr. Schreiner, helping the medical staff transform into this new regional platform. Matter of fact, I spoke to her this morning. She was on her phone helping coordinate a transfer in as we were speaking. And so it is a daily job, and the staff are doing an incredible job. If you think about the demand, and you may ask yourself, well, what is the demand? We are receiving patients as far west as Henderson, some from Mariah Parham Hospital, all the way to the Outer Banks Hospital. Matter of fact, we are getting about 4 to 5 patients a month from the Outer Banks Hospital specifically that are coming to Rocky Mount for their care. I spoke with someone here whose father or father-in-law had a medical emergency and was actually transferred in from Eastern North Carolina into Rocky Mount for their care. And so we are continuing to make that transition, and want you to know that it is an effort to make sure that we have the subspecialties for our community here locally. Our physicians here, we have been on a mercury rise of recruiting physicians. We've recruited about 30 physicians over the last 3 or 4 years. That may not sound like a lot, but in healthcare, that is a tremendous amount. Matter of fact, we are one of the best recruiters of physicians in the UNC health system. We get lots of questions about how we're able to do it. Jessie Langley is here with me this morning. She is our recruiter, and that really is how we're able to do it. She works tirelessly. And one of the things I asked, if you've ever seen Jurassic Park, you know that they talk about imprinting on the dinosaurs. Well, I like to imprint on the physicians, right? And I like to make sure that they understand, if they're going to join our community, what the expectations are in our medical staff for them to participate. So I told Jessie she knew that she was doing a good job when I got irritated because she was crowding my calendar with all the interviews that she was scheduling for physicians. I also told her, do not listen to me growling, and you keep scheduling those interviews. And she's done a tremendous job in doing that. And we are recruiting an incredible amount of talent here to Rocky Mount and Nash and Edgecombe County. I'm very proud of the efforts that the staff and the medical staff are doing. More importantly, these are physicians that we've recruited in the last several years. 90% of them live here locally in the community. I hope that you recognize some faces and they're involved either in your church, your civic groups, and your community groups, because they live here and work here. And that is a testament to the board. They were very clear. They said, you recruit physicians, they must live here in the community. And we have done a tremendous job of that through the efforts of the medical staff and the support of the board. As we move through and talk about the physical plant, One of the things that you'll be hearing us talk about more is our inpatient bed tower. If you've had an opportunity for yourself or a loved one to be in our inpatient rooms, you know a lot has changed in the last 50 plus years that Nash has been operating as a hospital. Our rooms are about 100 square feet less than what the standard room is now. They are all private rooms. We're very proud of that. And they all have bathrooms, but there's no shower. So if you want to take a shower, you have to put your bathrobe on and amble down to the end of the hall so that you can take an almost semi-private shower, right? We need to change that. More importantly, it's not a safe environment for our clinical staff and our nurses to take care of patients. The bed is pushed up against the wall. We can only access you from one side. That is not a safe environment. It is not efficient. The staffing arrangements are not efficient. We're spending some additional dollars to put staff that we could otherwise better utilize. Our medical staff, our room size, I talked about no showers, and then just as important is that the rooms, if you've been there with a loved one, you know that if you want to stay the night, that is quite a trick, and the staff and you have to be extremely flexible in the type of arrangement that you're willing to sleep in. You're probably going to be sleeping in a semi-vertical position, right? We need to do better than that. And so we are working with the board and consultants. We have designed and are designing this year a new bed tower that will go on the south entrance of the hospital. That's the main entrance as you come in. This is a rendering looking north towards that facility and what it could possibly look like. It'll have about 150 beds, new rooms. It'll allow for better accommodations. I'm sorry, it's going a little crazy. All right, we're gonna wing it. We will allow for better accommodations for family, better support for our nursing staff and clinical staff, and we look forward. We are in the design phase right now and asking for your feedback and our staff's feedback as we go forward. Again, all right, I'm going to stop touching this. Let them fix it. The hope is that we break ground in the next year, perhaps at late summer, and we're in it by 2027. This is a major milestone for your healthcare system, and it's about a $140 million project. So we do believe that it will contribute to the economic development of our region and help us attract industry and make sure that we're taking good care of our communities. So in closing, I want to thank you for the opportunity to share a few updates. If you come on campus, you will notice that we are changing our signs. We are aligning with the UNC system, new brand. We have changed our name to, it was Nash UNC. We are now UNC Health Nash. I know that I say that, I'll keep saying it, and I know that we will keep calling it Nash General. So know that it didn't change the governance. You still have a 14-member board made up of men and women who live here in our community. They have fiduciary responsibility, strategic responsibility, and they make the last decisions. UNC advises us, and we partner so that we can bring additional resources here at economies of scale. Thank you again for allowing me to be here and to serve you through the hospital and the healthcare system. Thank you.